That friendship goes back to 1968, and we just threw in a couple mountains in between.
You know what they say, friends who climb mountains together get bypasses together? Wait, nobody says that, except the guys you're about to meet today on All Things Heart. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Larry McElwain and John Lundstrom live in different towns and they have vastly different careers. Larry is a funeral director and an author. John is a U.S. district judge. Yet they share the forever bond of being old KU college buddies and KU basketball fanatics. And now they also share having freakishly similar near-death experiences that somehow also tie into KU basketball. Together since 1995, Susan McElwain says she knew from the get-go that a life with Larry would include KU basketball.
I am a devout Jayhawk fan.
Larry is a diehard fan.
I came to KU in 1966.
Another legacy from Larry's college days, his friendship with his good buddy, John Lundstrom.
We both were dating girls in the same sorority house.
And their passion for KU stuck.
I would say that I'm in the top 1% or whatever. And one of the reasons we live in Lawrence is at KU basketball.
So what happened just a month apart for these two friends, of course, had something to do with KU basketball as well.
We were both just incredibly lucky.
For Larry, the story begins on a bitter cold Saturday in January of 2024. He and his wife were heading into Allen Fieldhouse.
I get up to the building where the wind was blocking me, and I turn around and I was like, where'd he go? I couldn't find him. I was like, I don't know what happened to him. I looked back on the sidewalk and there was a crowd gathering.
At the center of the crowd on the ground was her husband.
One was doing CPR and the other one was checking his pulse, and she kept shaking her head like couldn't get a pulse.
Let's pause it here and fast forward to almost exactly 1 month later when John suffered a similar fate right after leaving Allen Fieldhouse on a bitter cold day in February.
We lived just about a half a mile up the hill from Allen Fieldhouse. It was a terrible evening. It was cold, it was sleeting, it was just miserable.
Misery was about to turn terrifying for everyone around John.
And the next thing I knew, I was being wheeled into the emergency room at Lawrence Memorial Hospital. I came to consciousness and the nurse said, well, you died, but they brought you back. Needless to say, that was something of a shock.
As both John and Larry woke up in their hospital beds 1 month apart, both learned they had suffered massive heart attacks. They were both saved by people who knew CPR. They were both diagnosed with ischemic heart disease, and both required open heart surgery. And the cardiothoracic surgeon for both friends, University of Kansas Health System Dr. Todd Crawford. Another common thread, the surprise that this could have happened at all to either one of them.
I literally never had chest pain, wasn't short of breath, never anything like that.
Having recently climbed 2 mountains together, both thought they were in great shape.
My biggest test of my cardiopulmonary was my ability to climb mountains, and I was able to do that.
Today, Larry and John are feeling good and on the mend.
It's just one of those things that you go, wow.
And while climbing mountains isn't in the immediate future, KU basketball is back on the calendar for both of them. We are so happy to have both Larry and John on the show with us today. Larry is here in the studio, and we have John joining us virtually from Lawrence, and we're also joined by their surgeon, cardiothoracic surgeon, Dr. Todd Crawford. Thank you for being here.
Thank you.
And you're also a diehard KU fan.
Absolutely.
And you were in a fraternity as well. Not the same fraternity as these guys.
Nope, but we share that bond as well.
Greek life.
Yep.
It's been a little more than a year since this horrifying thing happened to both you, Larry, and John. Larry, how are you feeling today?
You know, I'm feeling great, and I'm feeling very grateful that people were around me at Allen Fieldhouse and went to work on me right away. I don't remember any of that. The first thing I really remember is waking up at KU Med Center and meeting Dr. Crawford there after I'd already had open heart surgery.
My goodness.
Successful open heart surgery. And I but I'm doing well, and I also have Parkinson's disease, so that's causing me the most complications. I think the heart issue is well on the mend, but the Parkinson issue is a day-to-day thing.
Mm-hmm. Well, gosh, thank you for taking the time and the effort to come here this morning.
Well, thank you.
We really appreciate you joining to share your journey. John, how are you feeling today?
I feel great. If I weren't here right now, I'd be out playing pickleball, which I do most days of the week. So I'm making a sacrifice, but no, I feel great.
Careful
and
with
very,
pickleball.
Like Larry, very grateful to Todd, as well as my brother-in-law, who basically saved my bacon by doing CPR on me after I passed out. I also learned that Todd was at the game that night too, and so you can understand the trauma, because we blew a 13-point lead and lost. So there's all that probably was the only precursor that I can identify for what happened to me.
You thought the loss was the worst part of your night.
Oh yeah.
Little
Oh my
did
gosh.
you know.
I'll take open heart surgery for a win. I mean,
I was going to say, careful with the pickleball. We see a lot of injuries here at the health system from pickleball with our orthopedic surgeons.
It's rough.
But you're back to playing and you're feeling great.
Oh, yeah.
Now I've got
hiking and walking, and yeah, I do not feel any different than I did a year ago, save for the fact, or more than a year and a half ago, I guess, save for the fact that I am older.
Which is a good thing. If you don't get older, the alternative is not. And everybody wants to get older.
Having a professional relationship with Larry's old business if it weren't for that.
As the funeral director.
Right.
Right. We're going to get to so much of that, your business, the book you wrote, but that's in a little bit. I do want to ask Dr. Crawford right out of the gate. So the other freaky thing in common is you were at the game John was at.
Yes.
And you just happened to, I mean, you had no way of knowing that one guy in the audience, one of the fans, would one day be your patient. How soon after John's episode did you meet John? Because he was rushed to the hospital and then he was taken here. How many days between there was it?
Yeah, so he started at Lawrence Memorial and then was transferred to KU. I think the game was either a Tuesday or Wednesday night, and we operated Friday. First thing Friday morning, so it wasn't long after.
Did you realize when he came to out of the surgery that, hey, I was at that game too?
Oh, we talked about it before surgery.
Oh my gosh.
I said, it's a good thing I'm a little younger because I was equally heartbroken.
You were having those pains too. Dr. Crawford, I do want to ask you, because both Larry and John say they didn't have any symptoms. I mean, Larry, you put it perfectly. The litmus test for you was being able to climb mountains. Yeah. And you were doing that. Is it rare that people don't have any symptoms and they're in that kind of health before they have these heart episodes happen?
It is. We know it can happen. We call them silent myocardial infarctions or silent heart attacks. And the more common population that has those are diabetics or women. Sometimes we see it with older age, but it certainly can happen. You know, the interesting thing about both Larry and John is they were both very active.
Right.
John was pickleballing, multiple times a week before this happened, and Larry, like he said, had climbed mountains, and
together they were climbing mountains.
And so it's a little rare that you don't have any kind of warning, but what happens is that it's a supply-demand imbalance, and so in that cold weather or exerting themselves, the heart wasn't getting the oxygen it needed, and it can cause a fatal arrhythmia, which is what they both suffered.
We've actually interviewed you before about how cold weather can be dangerous if you're at risk for something, and you were walking in the cold weather to Allen Fieldhouse. John had just finished walking home through this nasty weather after the game. Do you think weather then was a big factor?
Oh, I'm certain that it probably played some role. Just in the myocardial oxygen demand they both were experiencing. The heart muscle was needing more oxygen delivered, and they couldn't keep up with that.
Larry, do you have diabetes?
I do not.
And John, do you have diabetes?
No, I don't.
So, and we know you're not women. So you mentioned diabetes and being a woman are two of the risk factors, and you didn't have either one of those, either of you. Yet you were both diagnosed with ischemic heart disease. Dr. Crawford, what is ischemic heart disease?
Yeah, ischemic heart disease, or sometimes we call it coronary artery disease, is blockage in the heart arteries that carry oxygen and nutrients to the heart muscle. And so that was the nidus for both of their cardiac arrests.
Okay, and go on, read.
And so we later learned that, once they went to the hospital, they had been resuscitated and defibrillated and then went for coronary angiograms. And that's when we discovered that they both had significant blockage in their heart arteries.
You shared some really cool images with us that I want to show our audience. I want to start with the images of what was going on inside John. What are we looking at here?
Yeah, so this is a coronary angiogram where they're shooting the left side. So the large structure at the top that's turning dark is the left main coronary artery, and then it branches into the main artery coming down the front of the heart, which is called the left anterior descending.
Can you
and then on the back of the heart, the circumflex.
Can you see blockages?
Yeah, so on that first shot, and then on this shot as well for John, you see a really tight lesion in his left anterior descending the main artery, and then here you actually see that he has a branch of his circumflex called the obtuse marginal that's flush occluded.
What is that?
So I don't know if you can see that coming down, but it's blocked and then it fills out towards the end from collaterals from the left side.
What does flush occluded mean?
So that means there's blockage that's prevented any blood flow going forward right at that level.
And then let's look at the images you shared of Larry. How many blockages did Larry have?
So this is John's last shot too. Okay. So he also has disease in the right coronary artery, right in that mid portion where it makes that C, right in the middle of the C. You see blockage there.
So scary.
So he had 3 main blockages, and then Larry actually had significant disease in his left anterior descending as well, which this picture is showing you. So near the top there, in this artery that's coming right down to the bottom right of the screen, you see a really tight blockage again. And then he also had disease in his diagonal arteries and in one of the branches of his circumflex. So he needed 4 bypasses.
Wow. And yet here you were thinking you both were doing great, going about your lives. Larry, when we first met you and your wife, you shared something with us that we have never seen before. I'd never heard of this. It's a pillowcase, but it's what's on the pillowcase that would be so strange for a lot of people to learn, because those are the notes the doctor and Lawrence wrote on a pillowcase to send with Larry in the ambulance to give to you, Dr. Crawford?
That was the signature move of that cardiologist.
Okay.
I have many pillowcases.
You have many? Because I was going to say, of all the technology, that's not rare for you to get a note on a pillowcase?
It's actually really helpful, just to confirm what we're seeing on the angiogram and what they believe is the culprit for this problem.
Let's listen to what Larry's wife had to say.
And he wrote down which valves.
Which arteries?
Which arteries need to be replaced and stuff. He puts it behind his pillow. He goes, I don't have any way of getting notes to KU once he's transported. This is how I send him my information. And I had Dr. Crawford sign it as well and add which artery he replaced.
That now is a wall hanging in my office.
It is?
It is.
Okay. I was going to ask, where do you keep the souvenir?
It's in my office.
Did you frame it?
Yes.
Okay.
Susan did.
It's so weird to hear that's how medical things are sent to each other. Why is that better than a fax or?
Well, so typically we get a report from the coronary angiogram or the left heart catheterization, and it indicates which vessels are bypassed. Sometimes it's more prescriptive, saying these are the bypass targets we think you should consider, and that's essentially what the pillowcase was.
Have you ever had any doctors send them that don't have as great artistic talent as this doctor?
No, I think this cardiologist is rather unique in that regard.
Really?
Yeah.
So he was a really good drawer, good artist.
Yeah.
John, do you have the souvenir pillowcase, or is it just Larry?
I do not. No, I don't know how they transmitted the information, but it was not by a pillowcase. I can say that.
Have you ever had it written on like a napkin or anything, or is it always a piece of bedding?
It's pretty rare to receive that. I think it's just one specific interventional cardiologist.
Oh, it's just that cardiologist that does it?
Yeah, so I think John's interventional cardiologist was a different cardiologist that night.
But you like that method?
Yeah.
It was very helpful. We already have some great questions coming in. If you have a question or a comment that you'd like us to share on air, just send it to us on YouTube, Facebook, or the All Things Heart email. You can find all the links on how you can connect with us right now in real time on your screen. Dr. Crawford, both men were saved by someone who just happened to know CPR. It was a stranger in your case, Larry. For John, it was his brother-in-law. What's the likelihood of survival for someone who has access to a person doing immediate CPR versus someone who would have had to wait for the ambulance to arrive?
Well, in the U.S., the American Heart Association estimates about 350,000 out-of-hospital cardiac arrests per year, and the survival rate is pretty bleak. It's about 10%. But we know that early bystander CPR, witnessed arrests, that's the key to survival. Without that chance of survival is about 1%.
That's super interesting as well, that the key to survival was a stranger knowing CPR.
Yeah. Actually, I've been told all this. I wasn't aware, but there were two ladies that saw me collapse just as I crossed Naismith Drive, and they began giving me CPR right away.
Oh my God.
And then a physician from here in Johnson County happened by, and he came up and joined in with them. And then the Lawrence medical team that were there for the game with the ambulances and all got involved.
We have some great pictures.
So I couldn't have been in a better place for what occurred to me, because I had people that were willing, that cared enough to try to lend life-saving,
support
for me. But it's just amazing. Yeah, that's the team, and I had the opportunity about a month ago to meet with them. And
that's the team of EMTs?
Those were the EMTs that worked on me, yes.
Who's on the right? Who are you with on the right?
That is a young man named Andy, who was the one that transported me to KU Medical Center on that Saturday evening. He knew of me. We did not know each other, but I consider him a key piece of all this, because he was with me at Allen Fieldhouse, and then he transported me from Lawrence Memorial Hospital to KU Medical Center.
How did you get to meet that whole team later on? How did you find them? Was that at an event?
Yes.
Okay.
It was an annual awards event, and they gave awards to teams that were involved in life-saving therapy.
Right.
So, yes.
Have you ever been able to track down the women who did the CPR initially?
No, I have talked to the doctor from here in Johnson County. I wanted to thank him. I wanted to say thank you for what you did, as well as thanks to Dr. Crawford for what he has done. But I have never made contact with the women. And it's also kind of interesting that I have a granddaughter that's in kindergarten, and she got connected to this whole thing through a child care specialist of what occurred that day at Allen Fieldhouse. So it's just been amazing, the connections that occurred. And there was also a connection to Dr. Crawford from a doctor that went to medical school with you.
Correct.
At KU? So there's a whole KU, some sort of synergy is happening here.
Yeah,
she's also your pediatrician, right?
Or obstetrician.
Obstetrician.
She delivered my last two girls. So.
It's amazing, the connections that occurred.
And then John, you were saved by your brother-in-law, who knows CPR.
Right.
That had to have been so emotional for him. Do you owe him dinner pretty much forever for the next times you guys go out?
Absolutely. I could never repay him, obviously, for his taking charge. He was a Naval Academy grad, atomic submarine officer. He's one of these guys, very cool under pressure, under difficult circumstances. He immediately knew what to do. Had my wife get me down on the floor so that I'd get my coat pulled back so that they could do CPR, while his wife called 911. and he worked on me for about 10 minutes before the EMTs arrived. The post-game traffic delayed the folks from LMH getting to our house, so he had put in a pretty good stint of time doing CPR. But he's just that kind of guy. But I guarantee you, he is on the top of my Christmas list, birthday list, anytime you want to list. I mean, no question about it.
The other interesting part that we can't stress enough is that both John and Larry have climbed 2 mountains together. These aren't guys that sit around. You're a business owner and author. John's a judge. So understandably, they were stunned when this happened to them. What are the risk factors, Dr. Crawford, for developing this kind of heart disease? Besides being diabetic, which they weren't, more women get it, which they aren't. What are the other major risk factors?
Yeah, that's a great question. Genetics and environment are the 2 principal factors in this disease, and so I would suspect that there's a genetic predisposition for both of them, because like you said, they're otherwise healthy gentlemen. They don't smoke, they're active, they exercise, but I'm sure there is a genetic component that probably led to the development of the disease. And you could see on both of the angiograms that probably there was probably some acute component to this, but also they had longer standing disease that had kind of paved the way for the problem.
So acute would mean the weather might have triggered
so sometimes patients that have a massive heart attack will have an unstable plaque that ruptures, and so a blockage that's maybe 20 to 30% goes to 100%, and then you have a large heart attack. Both of these gentlemen, they had evidence on their coronary angiograms that they had blockage that had been there for a while.
If it's genetic, is there a test either of your patients could get?
That's a good question. So, primary care physician or your cardiologist is the way to start, just to look at risk factor modification, check your lipids, your cholesterol levels. And then there are screening tests now. We often do coronary calcium CTs, which is a quick CT scan that gives you a calcium score and can predict the risk of having blockage.
I just got a calcium score. It's the only test you want to score a 0 on.
That's correct.
So anyone watching can get a calcium score. We do have some questions from our viewers, and Bonnie was just echoing, is there a test or a scan either man could have gotten that showed they were at risk ahead of time? Would that have been the calcium score?
Potentially, it could have shed some light on it if they had calcific disease, which I would think would be more common in their age group. But sometimes plaques aren't calcified. Those are the more unstable plaques, and they can be a problem as well.
Jean, one of our Facebook viewers, Jean Reardon, asks, had these men had high cholesterol readings on their blood tests before their events? Larry, did you have high cholesterol?
I did not.
Wow.
I did not. In fact, at one point earlier in my life, I had low cholesterol ratings. But as far as most recently, before the heart attack, I don't know. But it was not something that
not on your radar.
And my physician was not bringing that to my attention.
John, what about you? Did you have high cholesterol?
No, I've never had high cholesterol. My so-called good cholesterol has always been in the right range, and my bad cholesterol at the low end. So none of that was a risk factor that my physician had ever identified.
David wants to know, are there any symptoms before a heart attack, or do you only know in the moment that the heart attack is happening?
Yeah, they could be subtle. Things like chest tightness or pressure that comes with exertion and then goes away when you rest. Sometimes it can radiate to the arm or the jaw. Sometimes patients experience shortness of breath, or they get diaphoretic, where they start to sweat suddenly.
Did you ever have that happen to you, Larry?
No, I did not.
Gosh, John?
Nor I either. No, we were coming up the hill as fast as we could because the weather was so bad, and I wasn't even out of breath. I mean, it was just so weird because I had no sense of anything other than just being sorry we lost the game and glad to get home.
Right.
Nothing.
It's funny how things can just turn on a dime. John, how did you know, yours was a month after Larry, so
right.
When did you put it together that the same thing had happened to both of you, one before and one after a game?
Well, when Dr. Crawford was in visiting me on one occasion, he said, "Gee, this is kind of a coincidence. I had another fellow who had an event like that a month before you at Allen Fieldhouse." I said, "Oh, you mean Larry McElwain?" Because I knew that Larry had that.
And you have to have a poker face because of HIPAA, so don't know.
Well, yeah, I blew whatever HIPAA coverage there may have been there, but I knew independently that Larry was who he was talking about.
Well, you didn't blow any HIPAA coverage, and neither did Dr. Crawford. You guys just happen to know
No.
each other.
Right.
That is so wild. So wild that the history and how rare. I got to say, this isn't very reassuring, though, for people watching, wondering, what are the signs and how do you know? And this is just a freak thing that happened to two good friends
Yeah.
in the same circumstances.
And the stories are eerily similar, no warning sign. Yeah, it's just
It's wild.
remarkable stories. I think not enough can be said for the emergency responders for both of these gentlemen, to have them here today. That just speaks to the incredible care that they received early on. And for anyone that's done CPR, I mean, John's brother-in-law can tell you 10 minutes of CPR on your own, that's the same workout as climbing a mountain.
Because you can't stop till
Right.
the paramedics arrive.
Yeah.
He's going for 10 minutes in the middle of a storm. I can't even imagine, John, what that was like for your wife to have to watch this,
She
or
thought-
your wife.
She thought she'd watched me die.
Oh my God.
And they weren't getting a pulse even once the EMTs got there. They were kind of. She was in the other room, but she could hear them kind of going, "Well, I'm not really getting much here." And eventually, they got something and did some electroshock or whatever you call it, and decided I was going to make it. Well, at least had a shot at making it, so they hauled me off in the ambulance.
And that's similar to what your wife said, Larry. She said,
Yeah.
at one point, she said, I was thinking, I can't believe this is how it ends with my husband dying in front of Allen Fieldhouse.
And he hasn't even finished his book.
Okay, let's talk about your book.
All right.
Let's talk about your book. You brought 2 copies
Yeah,
for us.
I was in the process of writing a book, and I'd gotten up early that morning, and I'm an early morning guy, and I got up at 4 o'clock and went in and wrote. But then I went through skilled nursing. They took very good care of me, but I was in a funk. I couldn't write, couldn't think. I thought, I'm never going to get this done. And when I went home, all of a sudden, I wanted to write, and I did. And this got published in October of last year.
You want to hold it up, Dr.
Sure.
Crawford? Because you were at Larry's book signing.
I was.
And say the title of the book for us,
A
Larry.
life lived amongst lives lost. I was a village undertaker, is what I refer to myself as, for over 50 years. And I had retired from that, and my retirement job was I became the CEO of the Lawrence Chamber of Commerce.
Okay.
And that was a good retirement job for me, and then I transitioned into retirement.
So near-death experiences have a way of putting everything in perspective, and people will shift the course of their lives sometimes. John, did you become more rabid in pickleball after you had this experience?
No, I want to digress just a moment talking about Larry's book and his profession, because we also played on a softball team together and years ago. And one of our, actually the guy who sponsored the team was something of a smart aleck sort of a guy. And he always referred to Larry as Digger in light of his
Because grave digger? Okay.
So he always called Larry Digger.
And he still does to this day.
Jeez. That's quite a nickname.
But I once I got back through whatever the rehab process was, and by the way, I want to shout out to the Lawrence Memorial Hospital cardiac rehab process, because I thought it was really good. Helped make that next step after being able to walk. First to the end of my driveway, then a block or two, and finally a couple miles. Doing the rehab at Lawrence Memorial. Once all that was done, which took about a total of a couple of months, 3 months maybe, we took a trip to England and Ireland, did a lot of walking there. Then
Beautiful.
went out to Colorado and did our normal hiking routines of 3, 4, 5 mile hikes up up and down mountain trails and so forth. So, I resumed my activity, I think, relatively rapidly, and have maintained it to this day.
That's what we like to hear. As we wrap up this discussion, I want to ask, Larry, I'll start with you. What's the one thing you want our viewers to know?
Well, there's several things. The first thing is that, and this is a shout out to KU Medical Center, has an excellent staff, not only in surgery but care. And I really highly recommend what I learned here at KU Medical Center about Dr. Crawford and the other surgeons and doctors here. I think the other thing is that I think it's really important to take a CPR class, because you don't know. You just don't know. In John's case, his brother-in-law saved his life. In my case, it was an EMT that saved mine, plus 2 women who were going to the game, had no idea why I collapsed, but they figured it out pretty quickly and started right away. So I owe those people my life, my opportunity to go on. So I'm very thankful of that. And I also think it's really important. I wouldn't be remiss if I didn't talk about my wife and how important family is to rehabilitation. Just encouraging you on days when it's hard to encourage anybody. And I had those days where I was absorbed in self-pity. I had those days where I didn't think that I would ever get this written. But that encouragement and to be very grateful to your family is important. And I don't minimize that in any way.
That's so sweet. And Susan just adores you. It's clearly, it's obvious when meeting you both. John, what would be your final message to our viewers?
Well, I echo everything that Larry said. My wife, who's a KU Med grad in physical therapy, as actually my late father was got his medical degree from KU Med. So I've got a lot of good things to say about the KU Med and the role of family. My wife was a wonderful caretaker for me. I had a much easier time than Larry, I must confess. But she was really did so many things to help me at that, particularly the initial stage where I couldn't do as many things for myself, and then to encourage me to get out and do the other things I needed to do to get back on track. So I just second everything Larry said.
Also, John, you dressed to pay homage to your alma mater. Show us your...
Oh, yeah.
There you go.
There we go.
Now, you're a judge. Over the years, do you wear your KU fanfare underneath the robe?
Well, no, I kind of feel like some of the occasional stray Missouri lawyers that appear in front of me might take umbrage at that. So I was given a robe one time after doing some stuff that had a Jayhawk on it, which I've never felt comfortable wearing in court. But
presiding over.
I have it hanging in my chambers.
Dr. Crawford, what would be your biggest takeaway that you want our viewers to know from this?
Well, I think John and Larry said it well. From my standpoint, I think you see what makes this job so special is you get to meet extraordinary men like Larry and John and help them during a very vulnerable, scary time. And things move very rapidly in that setting, and both of them had trust and faith in the process and bought in and worked hard to get where they are today. And it's been a privilege to get to know them and get to care for them, and I've really profited from it as much as I think they have. So
you all need to take in a game together. Three of you in the stands.
We do. We talked about that.
Yeah.
Well, thank you so much for taking the time to join us, Larry. Dr. Crawford, thank you. And John, thank you so much as well. We really appreciate you sharing your journey with us. And thank you to our viewers for being with us today. If you'd like to watch or share any of our previous episodes, just scan the QR code on your screen. It will take you to links of all of our past shows. And coming up next week on All Things Heart, he was asked to give some final words at a city council meeting, and they almost really were his final words.
Hold on. Excuse us for a minute. We have a little medical emergency.
The Wichita State professor who wound up being the first case of its kind here at the health system when it comes to heart transplants. That's Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update. 12 kidneys, 24 surgeries spread across 8 states. I'm Jessica Lovell on the next Morning Medical Update. Meet the one man who stepped up and started this life-saving kidney chain. Friday at 8.